colleagues, the researchers who, like me, during the course of many years, have dedicated themselves to the study of advanced liver disease and its complications, have had their guiding star in the diagnosis of cirrhosis. And in most of the study, the diagnosis of cirrhosis was made either by liver biopsy or by clinical, lab and ultrasound data. So either in an invasive way or in a non-invasive way. In 2015, the Baveno 6 has introduced a new terminology: compensated advanced liver disease, or cACLD. Here then, several important questions arise. Can we use indifferently the two terminology, or there are big differences in between them? Which will be the consequences of the use of cACLD in our clinical practice? Which will be the consequences of the use of cACLD in the future research in the field? To try to answer this important question, we invited the three outstanding key opinion leaders, Professor Garcia-Tsao, Professor Valérie Paradis, and Professor Thomas Reiberger, to the next Journal of Hepatology linked EASL Studio episode. So we look forward to seeing all you Wednesday on February 21st at 5:30 p.m. to share this very, very important discussion. Thank you very much for your attention.